The Gauteng Health Department is urging the public to remain vigilant following the arrest of another bogus doctor. The latest arrest took place at the Chris Hani Baragwanath Academic Hospital in Soweto on Sunday. The suspect, who was wearing scrubs with the name Dr. Zulu, allegedly demanded a 700 Rand payment for medical assistance. And this comes months after social media influencer Matthew Lani was also arrested but later released for pretending to be a doctor. The public has been urged to report any suspicious activity. I'm joined now by Gauteng Health spokesperson Motale Modiba, who joins us for more. Motale, good morning to you, and thanks very much for being with us. This is a concerning development. What else have you been able to find out since this person was arrested?
Indeed, it is a concerning development, and rightly so. We want to continue warning the public not to fall prey to people that actually take advantage of the fact that our health facilities remain public spaces which have ease of access, and therefore it creates that loophole where scrupulous characters would want to take advantage and even go to an extent of taking advantage of people that are coming to our facilities. What we know is that the suspect was remanded after we reported them to the police, Diepkloof police station on Sunday, and they appeared in court yesterday at the Orlando Magistrates Court. This morning we were in touch with the warrant officer, just wanting to find out as to the outcome from the court proceedings, and I think they indicated that they would be able to communicate with us later today when they've got the docket with them. But the matter is being handled by the police, because obviously we had to report a case of impersonating a medical professional. You know that in terms of the law, it's a criminal offense to obviously impersonate a medical professional and claim to be, in this instance, the person even went to an extent of wanting to get a member of the public, an escort who was accompanying a patient, to actually pay something to them so that they can then, I don't know how they're going to assist them, but claim to assist them.
Yeah.
So that is where we are in terms of this particular matter.
Because it's concerning, right, Motale, in the first place, for somebody to have access to a medical health facility, to be able to put on scrubs, to be able to have the outlook of somebody who is a medical professional. So now that we understand they are not a doctor, and we'll get to some of the details as to how we arrived and how you and the investigators arrived at that conclusion, but they were there. Is there any possibility this particular individual is a member of the staff, perhaps not as a doctor, but a member of the nursing staff or otherwise employed by Chris Hani Baragwanath Hospital?
It doesn't seem like they are employed by the facility. I mean, all our employees would have basic things, your personal number. Even myself, I have that personal number. If you are a government employee employed by either the provincial or national government, you would have a personal number. They could not produce that. If you are a health professional, in terms of being a doctor or a nurse, you would also have to be registered with the HPCSA. They could not produce any of that, and they're not known. Because if they were a staff member, I think they would have been known at the facility. So they're definitely not an employee of ours, and the matter now is obviously with the police to investigate further. The issue of the scrubs and the uniform, of course, at this point in time, it's a gray area, because remember that anyone can be able to get scrubs. These are not unique uniforms that are custom made for only doctors. They get worn generally within the health profession, and to get one made for you, you just go to the nearest tailor and you get it, that you can get access. That's why we've got things like your identification sort of cards and other methods of identifying and differentiating, so that someone like this one who is able to come into a health facility, then we can then be able to pick them out. I mean, a person like this would not have been able to, for example, operate within a particular ward, because they would have had to introduce themselves and in terms of their credentials and be known by some of the staff there for them to even enter there. That's why I think the easier route for them was to to interact with patients as you're moving and try to offer some form of assistance, because there's no patient who will stop you and say, who are you, why are you wearing it this way, and so forth. But we are grateful that obviously in this instance, the member of the public was a bit alert in terms of realizing that why would the doctor want me to pay them and actually draw me outside of the facility and go into it. I mean, the pedestrian gate that you're talking about, it means the person was actually luring the member of the public outside of the admin blocks to go into a pedestrian area as if you're exiting, so that, and then I think
Mutale signal is a little bit patchy there. But just to come back and to pick up on this last point that you made, Mutale, it was due to the vigilance of the person who was escorting the person who was ill to be able to say, something doesn't feel right here. And that's what I want to pick up on is, in general, if you are at any facility, you are not going to be asked to pay a sum of money to a random person. Let's just, in the interest of the public, share how that process works so that the public knows when they are likely about to be scammed.
Look, there are certain fees sometimes that are payable in terms of when you access certain services. And if you are required to make any form of payment, one, we will explain what that payment is for. But secondly, at all our healthcare facilities, you've got admin blocks where normally your cashiers would be there to process this kind of payments. So you would be directed there, and they would be able to give you an invoice. So you would not be paying to an individual in terms of their individual capacity, but you'll be paying to a cashier who will then process your payment and be able to issue you with a proof of payment. We would never ask the public to actually pay on the site, a random person, and pay them on the site where there would be no proof of payment or there would be no clear explanation. In fact, we would never ask you to say, pay first, then we can assist you. In this instance, I mean, the doctor was saying, or the so-called Bogus doctor was saying, if you pay me this fee, I'll be able to assist you and so forth. That's not how we operate. In fact, doctors would be the last people to even ask you to make any form of payment, because by the time you get to the doctor, you would have been processed through the admin process. So they don't get involved in payments that need to necessarily be paid to the health system if there is such. In fact, I know that annually there is what we call the user pay fees that normally we communicate, and I think we will be communicating soon the changes in the tariffs insofar as certain services are concerned, so that we also advise members of the public further on how they can get access to those tariffs and the processes that we will normally embark on within the health system.
Gauteng Health spokesperson Mutale Modiba, thank you very much for the update. That case continues, and we'll keep you close to developments as well.